as I said,
Okay, sir.
vitamin D and insulin resistance, and so can vitamin D reverse or prevent type 2 diabetes. Now, I did this PubMed search yesterday, and you can see there has been a significantly growing interest in the number of publications related to the field of vitamin D and diabetes and vitamin D and insulin resistance, which only tell us that this is an important area for research. Now, some years ago, some 8-9 years ago, we did a survey of vitamin D levels in physicians from across the country. And here you can see, if you take a vitamin D level of 30 nanograms per mil as the cutoff, some 70 to 80% of the physicians, we ourselves are deficient in vitamin D. If you take it as the cutoff as 20 for sufficiency, even then around 64 to 72% of the physicians across the country are deficient in vitamin D. So before prescribing vitamin D to our patients, physicians, heal thyself. So that's the message from this slide. Now, Anastasios Peters back in 2012 in a publication, Diabetes Care, he for the first time showed that if you are deficient in calcium, your daily calcium intake is less than 600 milligrams, and your daily vitamin D intake is less than 400 international unit. So compared to the risk of diabetes that you have if it is taken as 1, which is on the top left bar on your screen, a person who has an adequate vitamin D intake, meaning thereby more than 800 units per day, and an adequate calcium intake of more than 1200 milligrams per day, the bottom right bar on your screen, the risk of having incident diabetes is reduced by 33%. So then there was this paper in Clinical Nutrition, some more than 1,000 individuals followed for more than 10 years. And as you can see, 12% with vitamin D level less than 18 developed type 2 diabetes, whereas around 5% with vitamin D more than 18 developed diabetes. And what is important to note here is that no one with levels higher than 30 nanograms per milliliter developed diabetes in this cohort of more than 1,000 individuals. So not a single person with a vitamin D more than 30 developed diabetes. But then when you come to meta-analysis of the published data, there you get a mixed picture. Some studies say that vitamin D does protect against diabetes, while others do not. So there remains a controversy. Now,
Sir, please do let me
you
know when you want to
all
change the
know that
slide.
we have. Yeah, I'm changing the slides from my end. Oh, sorry, it's not working. Okay, so I'm on the I'm on the eighth slide now. Slide 8. Please go to slide 8. Okay. Hello.
You can stop me. I changed the slide. On
Yeah,
which
fine. I
slide
will do
you?
that. But now I am on slide number 8. And I'm only 20 slides. So 29 slides. So anyway, so we have some interest in phetuin A as a hepatokine that causes insulin resistance. And in this study on the predictive value of serum phetuin A on glycemic control in people with prediabetes, we found that people progressing to type 2 diabetes had lower vitamin D. Not only that, can you see the slide now? Hello, Mr. Harshit? Mr. Harshit, can you see?
Sir, just a second. I share the screen from your 8th slide. and then now you can see the slide on your desktop, sir. Then you can tell me the change the slide. I can change it from my side. So
Okay,
well, just 1 second, sir.
okay.
So now you can see the slides.
Yeah,
Okay.
slide number 8. I'm on slide number 8.
This is the 8 number slide, sir.
Yeah, fine. So
Okay. If
and
you want to change the slide, just tell me the next slide.
no,
I
I'll
will
tell you,
change
I'll tell
my
you,
slide.
I'll tell you, don't
Okay,
worry.
sir.
Okay, so people who had lower rates of reversal to normal glucose tolerance in this pre-diabetic population, they had a lower vitamin D level. So this stimulated us to undertake this study whether vitamin D predicts insulin resistance in pre-diabetes. So here, as you can see in this study, we recruited around 500 individuals whom we subjected to OGTT with 75 gram oral glucose, and then to establish pre-diabetes, you need to confirm that the patients are having persistent pre-diabetes. So you need to repeat the OGTT within a week, which is what we did, and eventually we were left with some, as you can see, 136 subjects with pre-diabetes, of whom 124 were considered for final analysis. So next slide. 73% had vitamin D deficiency. Around 15% had severe vitamin D deficiency. Next slide. So Mr. Harshit, if you go on clicking, so significant negative correlation was seen between vitamin D level and insulin resistance as measured by HOMA-IR, and therefore we concluded that vitamin D deficiency may have some role in the development of type 2 diabetes. Mr. Harshit, is it going all right from your end?
Sir,
Hello?
completely all right. Are you comfortable to changing the slide with me?
No, yeah, I'm clicking, but I don't know whether
So
it's showing.
I give you the remote for the changing the slide.
No, please, you please do it from your end to
Okay,
avoid
sir. Okay.
further complications.
Okay, sir. Okay.
Okay. So while writing the editorial on our paper, Anastasius, I'm sorry, Anna Maria Cola from Federico Naples University, Italy, she commented that severe vitamin D deficiency was about twice more common for individuals with pre-diabetes. That is in the next slide. Individuals with severe vitamin D deficiency had the highest insulin resistance. So vitamin D deficiency therefore could represent an independent risk factor for progression to type 2 diabetes. So going to the next slide, uh, uh, so Anna Maria Cola actually suggested that to pinpoint the real extent of the relationship between vitamin D and the risk for diabetes in the Indian scenario, further studies are needed. So we progressed to our next study, which is an intervention study involving vitamin D. So the aims and objectives were to evaluate the role of vitamin D treatment on progression of pre-diabetes to diabetes and or reversal of pre-diabetes to normal glucose tolerance, which was the primary endpoint and the topic of discussion today. And we also studied the effect of vitamin D on insulin resistance, markers of systemic inflammation, and lipid profile, which were the secondary endpoints. So busy slide, I'll just go on clicking, and Mr. Harshit also please accompany me. So we selected screened around 2,000 individuals from diabetes detection camps, and after application of the inclusion and exclusion criteria, we were left with 500 people with pre-diabetes whom we subjected to oral GTT, and 300 qualified as overweight and obese Asian Indian women with prediabetes, and they found out in this open label study involving 121 females followed for 78 weeks that there was a significant decrease uh, in fasting blood glucose, 2-hour blood glucose, HbA1c, with increase in vitamin D levels in the intervention group as compared to the placebo group. So here you can see fasting blood sugar. I mean, I hope Mr. Harshit is on the next slide, which shows the table that fasting blood sugar normalized in 58.6% in the vitamin D group compared to 48.8 in the placebo group, and this difference was statistically significant. So vitamin D supplementation in this cohort was able to normalize fasting blood glucose in a significant number of patients, and then reversal to normal glucose tolerance, as you can see in the bottom, was achieved in more than 50% of subjects in the vitamin D group compared to around 43% in the placebo group. Again, the difference was statistically significant. So vitamin D supplementation was clearly shown in this study population to lead to reversal of pre-diabetes to normal glucose tolerance. Almost so this is the last slide. So to wrap up, vitamin D deficiency increases the risk of insulin resistance and type 2 diabetes. Vitamin D supplementation in people with pre-diabetes who are deficient in vitamin D increase the rate of reversal to normal glucose tolerance. So this is very important. If people have normal vitamin D and pre-diabetes and you give them vitamin D, nothing may happen. But if they're deficient in vitamin D and have pre-diabetes, giving vitamin D in therapeutic doses in them might lead to a reversal of diabetes, or at least retard the rate of progression to type 2 diabetes. So D2D study where participants had pre-diabetes at baseline but no vitamin D deficiency. Vitamin D did not protect against type 2 diabetes. In the post hoc analysis, 103 participants with vitamin D deficiency within the same cohort had a 62% relative risk reduction for type 2 diabetes. Therefore, future studies should determine whether vitamin D is effective in preventing type 2 diabetes in persons with baseline vitamin D deficiency. So that brings us to the end of this presentation, and those who are more interested in vitamin D in health and disease, this is a recent publication by our group from the Asiatic Society. You can go through it, and that's the final slide. So thank you for listening.